Aloha, welcome to knee rehabilitation post-surgery. So again, we're talking about how scar tissue can build up in the knee joint after surgery. And part of a successful recovery means that you work through that scar tissue so that this hinge joint, the knee, can come into more full flexion and full extension. And in this exercise, we're working towards extension, the knee's ability to totally straighten out the leg. And so this one is done, all you need is a soft place to lay, soft but also firm, and a nice rolled towel, rolled nice and tight. So you'll lay down with the towel right behind your knee, more towards the top, more towards the thigh than the shin. Okay, and then as you lay down, you'll get nice and steady in your belly. So that just means you'll tone your abdominal muscles by scooping your tailbone towards your heels, so you get this flattening and pulling down sensation in the lower abdominals. That's important just for making sure all the work stays in the knee action and doesn't translate into the hips. So steady your belly with that scoop of the tailbone and that pulling down of the low belly, and then you're toning your foot. It's flexing, the toes are fanned, the sole of the foot feels like it's yawning. Also, stability in the foot will keep the action from leaking away from the knee joint. Steady foot, steady core, and then you're pulsing, pushing into the towel, releasing, pushing into the towel, releasing. And right after surgery, your knee may be sort of locked in a bent position. That's totally normal, don't panic. You may need a thicker roll to get the pressure of the leg to push into the roll. That's okay. Yeah, you can even use something bigger like a foam roller to have some reference for the knee. So this is a nice thick foam roller, and if my knee were, say this was the full extension after surgery, I'd maybe want to use something higher so the knee feels supported and also has something to push into. So either a rolled up towel as the extension in the knee gets stronger, and you want it right above the knee. I tone the belly, I tone the foot and the heel's on the ground, and I'm pushing and pushing and releasing, pushing and releasing, pushing through the back of the knee, releasing, pushing, holding, holding. And there's probably going to be a little pain and the mind will grumble, but it's worth it. So you want to do this exercise maybe 3 times a day, 5 rounds. Maybe 50 repetitions as you get stronger. And you do want to go to a softer roll eventually, because you want to be able to feel your leg pushing into the softness and getting the leg straighter, getting the back of the knee closer to the ground. Yeah, so pushing and releasing. It's very similar to the exercise that we did with the TheraBand tied around a post and pushing back into it. It's just a different perspective of the same action of moving the knee into its full extension and getting this VMO, vastus medialis obliquus, this inner quadricep, to pull up to get that full extension. So we're strengthening the VMO, and we're stretching some of the ligaments behind the knee, getting that mobility, that full extension back into the joint. Happy recovery.